A very warm welcome to all of you joining us from across the globe for this important webinar on the FDN Medevac membership plan, your global lifeline in an emergency. My name is Medevac. So without further ado, I'd like to introduce our speaker, Ayo Adio, who is our head of operations here at Flying Doctors Nigeria, and he will be giving a brief presentation on Flying Doctors Nigeria, and he will also speak about the FDN Medevac membership plan and how it benefits corporates and individuals. Ayo, the floor is yours.
All right, thank you very much, Demebi. So good afternoon, everybody. My name is Ayo, and welcome to the Flying Doctors Nigeria webinar. So this is actually the first edition of the series of webinars that we typically hold on a yearly basis, primarily just to create, and bring to sort of the awareness of corporates as well as individuals about our essential membership plan, which is something that we think is crucial for every individual to possess, particularly if you're living within the region of Africa. So just looking at the table of content, like I did mention, we want to make this as fast as possible. So we'll just quickly give an overview as to who we are at Flying Doctors Nigeria. In a summary, so we're actually an emergency and health response service. So we've actually been existing for over a decade. We are based out of Nigeria, but then our coverage spans globally. So I think over the period of our existence, which at the moment, if I'm to be specific, is 12 years plus counting, and we've been able to build capacities across the entire value chain of the healthcare system. But by and large, this is just a quick summary of some of the services that we offer at Flying Doctors Nigeria. Our medical logistics transfer services, which is something that we are typically known for globally, to be honest. So the other level of service, which most people are just starting to get more familiarized with, are what we've also highlighted here. So we specialize in air ambulance transfers, patient stretcher systems, ground ambulance transfers too as well. So we have a Medevac cover plan, which is what is even a focal discussion today as well. We provide consultation and training services, healthcare as well as health and safety consultation services to clients across board. We provide medical equipment, supply solutions to facilities, hospitals. We also work with the public sector too as well to deliver on most of their healthcare projects. We provide medical assistance service, which basically is a bucket of different solutions that we offer to our clients, our international partners, both insurance companies, assistance companies, corporates, and then even for individuals too as well. Then lastly is we offer remote site service solutions, which typically usually is for organizations that have operations either offshore or at remote locations, which would fall under the oil and gas, the mining, etc. So we offer services as well that are specific or special to that category of industry players. So this is just about a quick summary of the different services and solutions that we offer at the Flying Doctors Nigeria. Then very quickly, like I did mention, so we're a company that we're an indigenous company. So we're proudly Nigerian, to be honest, but then we're based out of Nigeria. And like I did mention, over the years, we've been able to build capacity strategically through affiliations as well as partnerships with different international bodies. And at the moment, as we speak with you today, so we have presence across the 36 states in Nigeria. We also have presence in 160 countries through our strategic partnerships of a population of, say, 200,000 partners that we work with to deliver on the different healthcare solutions, which I did mention on the previous slide that we offer across board. So our service is not just restricted to the region of Nigeria alone. We've been able to build that, amass that capacity to be able to deliver service on a global scale. So this is just a quick overview of Flying Doctors Nigeria, and we'll be going straight into the business for the day, like I did mention. So like we highlighted, so today we'll be discussing on the FDN medical membership plan. That's the medical evacuation membership program. And I'm sure the first question that will definitely be coming to our mind is what typically is this all about? So just to give us an overview, so the FDN membership plan, so is actually an essential life-saving solution that we typically offer to individuals at different levels. So we do offer it to corporates, we offer to individuals, we offer to government parastatals too as well. But basically it's a subscription plan that enables access to medical transfer as well as hospitalization at no out-of-pocket cost. So subscribers typically to the FDN membership plan would have access to quality care in the event of a medical emergency on a global scale, so worldwide, not just restricted to the region of Africa alone. So who is it for? So like I did mention, it's for literally every individual. Is usually, we could say, is our target to a large extent, given the crucial need for this level of product to have as a backup plan. But on a general scale, typically the service is a subscription that is open to both children, to individuals, to corporates, as well as to families. So there's no restriction as to who and who could come on board to become, say, like a member of the Flying Doctors Medevac Evacuation Cover Plan. So very importantly, why is this important? So one major factor that I think you would also agree with me is that access to quality care across the region of Africa is very limited. So we are faced with multiple challenges ranging from deficiencies with regards to the level of investment in healthcare, deficiencies with regards to the infrastructures that we have to deliver the level of care. Brain drain is also a significant factor that we're experiencing greatly even in Nigeria. So this is something that you and I are even quite familiar with. So we are faced with multiple challenges, and coupled with this, we are unfortunately also plagued with a high level of disease burden that we have to deal with within the country. Nigeria, for example, also records almost the highest rate of accidents that happen if you look at it on a global scale. So these two factors put together puts us in a very dire situation where you and I always need to have a backup plan that would be sort of like an escape route that would enable us get access to quality care when the need arises. And this is what this membership plan hopes to achieve, to ensure that subscribers, in the event of a medical emergency, when they are faced with a medical emergency, would have access to advanced level of care that typically would be available in other climes. So just to further give us an idea as to why we think this is crucial, particularly with laser focus on the African healthcare landscape. So if you look at the numbers, we just thought to put this together very quickly. So this is just roughly an estimate, because I think by the day the numbers keep changing. So this is why we think this is something, the membership plan is a solution, or it is a program that is essential, basically as much as possible, for every individual that resides, particularly in the region of Africa, to possess, because it provides that level of security and usually an escape route to be able to access advanced medical care that typically will be available in other clients. So this is just a highlight of some of the statistics, the poor statistics that we also still maintain within the region with regards to the high accident rates that we typically record in comparison to the global accident rates, the cases of death that do occur from that incident too as well. And part of the major problem that has usually been highlighted for the high number that we do record within this region is as a result of the timeliness to access advanced medical care. So there's usually a large time lag. So the time is a challenge, and then the quality of care is also a challenge. So those are the two major factors. Even for us as an organization, I think over time what we've tried to do is that we've tried to build capacity to ensure that we provide support in three key areas. One, timely access to care. Two, quality of care. And three as well is also the cost to being able to access that too as well. So those three elements per time are what we look at from time to time to try and see how we can support or provide some level of support to the region of Africa with the sole aim of ensuring as much individuals have access to care as much as possible. So we just thought to amplify that, just to give us an idea as to why we always say that this is a crucial thing, a crucial subscription for every individual to consider. So what are the benefits typically that an individual would typically have access to whilst subscribing to the plan? So one, like I did mention and I've been emphasizing over time, is that it guarantees that level of security and to a large extent safety, given you would have the assurance that, say, in the event of a medical emergency, regardless of your location globally, you would indeed have access to advanced medical care, not just access in terms of the transportation as well as the resultant hospitalization. So you would have both covered at least to a significant extent and enable you have access to that high level of care that is required to enable a positive healthcare outcome. So that's one of the first crucial benefits that the plan offers, that peace of mind that it provides. And then the second two as well is the cost saving that it provides, even for individuals as well as for corporates to a large extent. So what this membership plan does typically is that it averts that financial burden. So usually in the scenarios where there are medical emergencies, there is a burden, two levels of burdens, which typically what overwhelms individuals. So the emotional burden as well as the financial burden. So to a large extent, the financial burden is completely or would completely be taken care of for subscribers that are on board to the membership plan in this regard. So that's also a significant benefit that it provides. Then, like I've also been hammering, is the worldwide access that individuals would have to medical care. And I think one interesting part too as well about the membership is that to a large extent, there are no as much restrictions as you would have typically, say if you say for the regular HMO plan that you and I may already be typically say subscribed to, because usually for them, for example, just to expatiate on that, so typically they would have a list of hospitals which you ordinarily would have access to, be category A, category B, category C, D, E, F, depending on what category of plan and we are utilizing. But for this arrangement, is usually the facility that typically would have the capacity to manage whatever condition to a large extent that you would have access to. So there are no limitations or restrictions to regards to is only hospital A, is only hospital category B that you would have access to. So that gives a pool of options to always explore with regards to at least enabling a positive healthcare outcome for subscribers in the event, say, of a medical emergency. So just to throw more highlights on some of the specific benefits that the plan provides. So like I did mention, I think one which is crucial is the transportation part. So being a member, you typically would have access to air ambulance transfers as well as ground ambulance transfers. So that typically is something that would typically be covered for subscribers. So cost of hospitalization, resultant hospitalization as a result of the medical emergency is something that also will be covered by the plan. And you have access to the FDN network, so not just even a hospital network, so our network worldwide. Like I did mention, we have well over 200,000 partners, healthcare partners with footprints in over 160 countries. So that's also a benefit that you would also be open to enjoy. So there are other significant benefits that it refers to as well. Intensive care admission for critical conditions or medical emergencies. So surgeries too as well as something that we considered, but typically there are terms and conditions with regards to that area. So this is just a little highlight of some of the additional benefits that the membership plan provides. So usually we would have typically a policy document that we would often share with members to give them an idea as to all of the benefits that they usually would have access to for being a member or part of the FDN membership plan. Then I think also one thing that we crucially usually like to communicate oftentimes is the significant financial benefit in terms of cost savings that this usually provides, particularly even for corporates. So that's why usually we like to do an analogy of say what typically the cost would be in the event of a single event of a medical emergency, as against having, say, at least 250 of your staff, for example, covered under the Medevac evacuation cover plan. So this analogy that is just before us. So usually for a transfer case, let's say, for example, an individual comes down with a medical emergency for a particular condition, it could be a heart attack, for example, because that's something that's quite rampant. So typically, the average cost to transfer an individual to, say, somewhere close by Europe, which is usually a close destination where you have advanced medical care, say London and Europe, is well around $100,000, and that usually is just for a category of an aircraft type, say probably the medium-range aircraft. If you're looking at the long-range aircraft, it's usually a lot higher. So if you're looking at something well around $120,000, $150,000. So then, aside that, looking at hospitalization too as well for those regions, particularly for non-citizens, that's for international patients, for example, the cost is slightly somewhat higher because you don't have access to NHS and all of the benefits that comes with that. So roughly an estimate would be well around 200,000 or even more for you to be able to access care within that region, depending on what the condition is, the severity, as well as the level of resource that is required to bring back the individual to his or her original healthy state. So roughly you'll be looking at, say, well around $300,000 to be able to tackle a severe medical emergency situation if you are faced with as an individual. So having to pull this out of pocket, even for the 1%, to be honest with you, I think from the experience we've had even in our dealings with some of the HNIs, is usually a difficult decision to make because it's a chunk of funds that is having to be merely because of a medical emergency. Whereas if you have, say, for example, 250 people, say, for example, subscribe to a medical plan. So given the emphasis I'm using for here with this example is regards to corporate, that would typically translate to $250,000 with regards to the premium that will be paid for those individuals. But then, you have 250 individuals who, say, for example, in the event of a medical emergency, for any reason or for any cause, would have access to medical transfers as well as hospitalization at no out-of-pocket cost. So for that level, in the event that any situation of sorts occurs, which usually is not something we pray for, but typically we just have to plan for, at the end of the day, you know, hands off financially. There is no struggle financially. Typically, that burden is lifted up and it will be taken up by us, typically, who is the provider of the FDN membership plan. So that's one crucial benefit that we always try as much as possible to make our partners understand, given the level of benefits it does provide in that regard. So then, how can you become a member of the Flying Doctors Medevac medical evacuation cover plan? So usually it's very easy. It's a three to 4 step process that usually is able to can be completed, say, within 48 to 72 hours, depending on the speed of response too, as well, from the interested subscriber that is looking to jump on or go on board the plan. So usually, like I mentioned, 3 days, and the process is actually as straightforward as possible. Usually we just need to be contacted. We typically would share what the membership form looks like. That would have to be filled and sent back to us for review and assessment, just to ensure that an individual part-time is eligible. Like I did mention, there are no restrictions. You can have children as a member, a child as a member, you can have an adult as a member, you can have a man, you can have a woman, that's male, female. There are usually no restrictions with regards to who could probably subscribe to become a member at any point in time. So usually once the individual has been certified eligible to come on board, then usually we just need to communicate what the acceptance requirements will be, and once that is fulfilled, immediately a membership number will be shared and you immediately have access. Your plan typically will be activated, and you know that in the event of an emergency, you are guaranteed access to medical transfer as well as hospitalization on a global scale. So pretty much this is a very quick summary as to what this plan provides and why we think is something very crucial and essential. Just to the slide also, this last slide that we are currently on also just highlights what typically the response plan is for during an emergency, which is definitely you just have to put a call to us, we confirm, we verify what if you're actually a subscribed member to our plan, and once the clinical information needed are made available, reviewed, and then is ascertained that the next level of action would be for you to have to seek medical care in an advanced destination, then all the necessary steps will be taken, both administrative, aviation, and clinical, to ensure that you do receive the required level of care within the shortest time possible. So this is about it with regards to the FDN Medevac evacuation membership plan, and it's something that is very crucial for individuals, for corporates to also consider. So given the dareness we are faced with, particularly living in the region of Africa, I think we are faced with multiple challenges at different levels, and it's just essential that we have a plan in place that ensures we're able to access advanced medical care when the need for that arises. So this typically brings me to the end of my presentation. And I think usually the next phase for us is just to open the floor very quickly for us to get, say, questions and provide clarifications as to certain areas that you might have concerns about.
We already have some questions from our attendees. We already have says, to what extent are these emergencies occurring for corporates? And if there are no occurrences for a period, for example, 2 to 3 years, the clients get any rebates or added benefits? So over to you, Ayo.
Okay, so I would answer these questions in 2 fronts. So typically there are industries that operate in what we would term, say, high-risk industries. Like I did mention, say, for example, the oil and gas, the mining, because of the nature or the scope of their work, they typically are exposed or more exposed to, say, for example, an individual that works in a financial institution or a bank. So that's one aspect. That's one aspect to it. But with regards to so for that, there are different arrangements that usually we would have for that. For both parties, we can confirm definitely we can be covered by different means to ensure that there's access to advanced medical care whenever the need arises. Then, but with regards to there are no rebates. But what we pride in typically as an organization is that we ensure that even during the period of your subscription, you are indeed receiving value all through that period. So whilst typically, like I did mention, none of us, even myself, we would never hope for a medical emergency that would require we would have to resort to seeking medical care in foreign destinations. But it's just to have that plan in place in the event of that. So during that period, if there are no occurrences, there are typically value-added services that your team will definitely benefit from as corporates. A typical example would usually be the trainings that we do organize over the period that are more related to health and safety, to ensure that safety within the organization is improved. Safety in terms of an individual is something that is also taken up significantly. So we do have level of trainings that we do offer in that regard as an added benefit during that period. For certain partners too as well, depending on the volume of subscriptions, we do have vouchers. Say for example, vouchers that we do offer sometimes for medical checkups, just to ensure that you remain in that healthy state whilst going about your daily business or on a day-to-day basis. So as much as possible, in as much as we know that this is crucially something that kicks into play when there is an emergency, we ensure that even during that period where there might be no such occurrences, we ensure to deliver value and ensure that we, in one way or the other, improve your personal health outcomes as an individual or as a corporate too as well, because health and safety is something that we take very crucial even for our own operations as an organization.
I have another question here, and someone is asking if we have a product for family.
Yes, so like I did mention, it's something that cuts across board. So as much as possible, I think what we've done is try to design the membership in a way where there are no limitations or restrictions. So as a family, you can have your family on board, you can have yourself on board as an individual, you can have children as well on board. So it just I would just say probably the premium may just vary per time, but typically it's open to subscription even for families too as well, down to children. So there are no restrictions with regards to who and who can come on board. So just quickly too as well, I think I can see a few questions on the chat box that I would just like to attend to quickly. I think I can see Lucia Martins. So I've answered the first part of her question, but there's also a question that says, what is the difference between this and Bupa? That is, does Bupa have a lesser advantage? So no, so I might not be able to directly answer if they have a lesser package or not, but what we can assure you of is with regards to the huge significant level of value that our package provides. So there are similarities with regards to the coverage. If I will be honest with you, there are similarities with regards to the nature and the scope of the coverage, because our own coverage with regards to where you have access to is also on a global scale, a worldwide scale. But I think one differentiating factor, particularly for us, is that we ourselves are actually healthcare providers. So we are more like an executors ourselves. So what that means is the speed of response for us particularly is usually higher. And why that is because we have both the resource to execute as well as to provide the coverage. So just to give you a typical example, say for example, if a member under the Bupa plan comes down with a particular illness and is in Nigeria and needs to be evacuated to XYZ location. So typically Bupa would have to contact their provider partners. So the provider partners that would then be activated and would have to support the member in terms of arranging for the air ambulance to move him from one location to another. But for us, once it has been predetermined from the level of clinical information that will be provided, that the next point of call is for the individual to be activated and approval for that is secured, we would be executing it ourselves. So that's what it increases the speed at which you get response to having transported from one location to another, and reduces that level of inefficiencies or back and forth that could delay that process as a whole. So I think another question that okay.
Yeah, there's another question. Someone is asking if the membership is a monthly paid out subscription and how much it is.
Okay, so it's an annual subscription, not a monthly paid out. So it's an annual subscription that if it's paid, it covers you for a period of 1 year. So it's not a monthly subscription. But yes, in terms of the cost, so it actually varies because there are usually different levels of coverage. So we have solutions that are specific to say you haven't been covered, say for the region of Africa alone, to include South Africa. So what I mean by that is that you would have access to advanced medical care available within the region of Africa to include South Africa. We have a comprehensive cover that is more of a worldwide coverage, where you have access to medical care available at different destinations worldwide. So that would vary. There are other things that would also impact on the cost with regards to factors, say like the age and etc. There, that's why usually the first line of action, like I did mention whilst discussing on the steps, is that we usually would require a certain level of information, and that is what will then inform what the applicable premium per time would be, say for an individual, for a group, for a family, etc. But what we can assure is that usually cost effective compared to usually what is obtainable at other clients or other destinations.
All right. Thank you very much, Ayo. And another question: what are the steps involved in activating the FDN Medevac membership plan?
So usually with regards to the steps, so it depends on, I think, a typical scenario with regards to, if I were to use a case analysis as an example. So to start off with, say for example, if an individual comes down with a medical emergency, for example, so usually the first point of action is that we expect that the individual, say for example, family member that probably might be around, is that the individual be taken to the closest facility just for stabilization. Stabilization, I beg your pardon. So once that is done, usually what we'll just need is some level of notification. So notification via email or notification via call, and then verification of the member's details. So once that is gotten, usually we'll just require sufficient clinical information to enable our medical team in-house, alongside the underwriters, would have to review, and then to ascertain what the immediate or next point of action would be. So if it is assessed, for example, that the facility in question where the patient is already admitted, say has the resource or has the capacity to manage that condition, so usually we'll just take up whatever the financial implication would be to ensure that the patient receives care all through the duration of the course of the treatment. But if it is also ascertained that there's deficiency with regards to the capacity to maintain or to manage such conditions, then the decisions will be made to have them move patient to the nearest possible destination where we know the level of care required can be assessed. So usually that's how it functions. It might sound a bit long because I'm explaining it, but usually it's usually within a short time frame we're able to complete that. So long as we have all the required information made available quickly, we are always able to respond with what usually would be the next line of action, and then handhold the contact person all through till we get the member back to his or her usual state.
I have another question here, and someone is asking if we have a product for family.
Yes, so like I did mention, it's something that cuts across board. So as much as possible, I think what we've done is try to design the membership in a way where there are no limitations or restrictions. So as a family, you can have your family on board, you can have yourself on board as an individual, you can have children as well on board. So it just I'll just say probably the premium may just vary per time, but typically it's open to subscription even for families too as well, down to children. So there are no restrictions with regards to who and who can come on board. So just quickly too as well, I think I can see a few questions on the chat box that I would just like to attend to quickly. I think I can see Lucia Martins. So I've answered the first part of her question, but there's also a question that says, what is the difference between this and Bupa? That is, does Bupa have a lesser?
All right, thank you very much, Ayo, for your response. And I think with this, we've come to the end of this webinar. Thank you so much, Ayo, for your time, and also thank you to our attendees for participating. Thank you for taking out time today to join us in this webinar, and do enjoy the rest of your day. Thank you. All right, thank you very much, Ayo, for your response.